Lift the uterus up and retrovert it so that bladder dissection can be easy. First, the cornual pedicles are detached. Once the round ligaments are cut, the two leaves of broad ligament are separated. First step is to recognize medial umbilical ligament. Bladder never extends beyond medial umbilical ligament. So we can cut the peritoneum boldly till about the medial umbilical ligament. Medial to the medial umbilical ligament, beneath the UV fold of peritoneum, there can be adherent bladder. So, cutting UV fold of peritoneum from here onwards must be done carefully just to involve only the peritoneum and not the bladder underneath. After the medial umbilical ligament is reached, the peritoneum is lifted up by inserting one of the prongs of bipolar shearer. It's coagulated and is cut only with the tips. This process is repeated from one end to the other. After separating the peritoneum, now we will concentrate on the lateral window creation. First, the bladder flap is lifted up using Babcock's. Just medial to the uterine artery, draw lines with the bipolar shearer from above downwards. While drawing these lines, you can feel the rough scarred area above and the soft, unscarred area below. In this soft and supple, unscarred area, we have to create a lateral window, for which we have to lift the bladder flap upwards, insinuate the prongs of the bipolar shearer underneath, medial to the uterine artery, and separate the prongs in such a way that a small window is created. This window has four walls: the roof, which is formed by the bladder, and the anterior portion is usually the scar, the posterior portion is the bladder again, and the floor, which is formed by the cervix. Window is widened by shifting the posterior fibers more posteriorly, anterior fibers more anteriorly, and the remnant fibers of these bladder on the cervix, shifting them towards the roof. Repeatedly keep shifting the bladder fibers from the floor of the window towards the roof. Creating this kind of a window will help in separating the bladder from the cervix below, and the only attached portion of the bladder to the scar on the lower uterine segment becomes obvious. Now it's time to cut the scar. So now the bladder is lifted and the scar is delineated separate from the uterine arteries, and nick is given on the scar area slowly and steadily in order to see to it that none of the bladder fibers are cut while cutting the scar. While cutting the scar, make sure you cut the scar more onto the uterus and not onto the bladder. Giving traction on the bladder to delineate the scar completely is very important while cutting on the scar area. This way, giving traction on the entire bulk of bladder fibers, creating a window underneath, delineating or demarcating the scar area, and separating the scar from the cervix underneath is repeated several times so that the entire bladder is separated from the cervix. This is how the bladder, which is adherent to the lower uterine segment or to the cervix, at about the previous caesarean section scar, is separated systematically. Hope this video is informative. Thank you for watching. Please like and subscribe.